Today's show is on the topic of science and the pandemic. We're going to take a look at some of the common myths as well as how we use science during a pandemic. And my friend, Dr. Larry, is here to help us lower all the complications on all of these questions that we have. Larry has been a PA for more than 12 years in Massachusetts, and we have a very good relationship going all the way back to when we did our doctorates together. So welcome to the show, Dr. Larry. It's nice to see you.
Thank you, Dr. Rebecca.
So, Larry, I have gotten a lot of questions these last couple of days as I've been talking to people about how we are going to do this show. So I'm sure you have things you can add to this. But our first question is, will the vaccine be responsible for herd immunity?
Well, it's not responsible for herd immunity, but it is contributing to herd immunity. So the more people you vaccinate, the more people in the population have some kind of immune defense against the virus. So once you become infected with the virus, naturally, you get an immune response and antibodies. And that way, if you're exposed to the virus again, or a variant of the virus, then your body can fight it off relatively efficiently on its own. Even though you have been exposed to a virus, you can become infected a second time. So it's not unheard of. But your body reduces the severity of the symptoms to the point where you almost don't feel like you have an illness. With a vaccine, because it's an artificial trigger for your immune system, you do get an immune response, and that is contributing to the herd immunity. It's just not quite as effective as your natural immunity. Say if you were exposed to a virus and then developed that immunity yourself. But it's still contributing, but it's not responsible for herd immunity, but it is helping.
So that's very interesting, because I think a lot of people don't understand like what a pandemic is and how often we have them. Because I believe that this current pandemic has been like, we've recently been seeing an increase in pandemics. At least I think that we have. But I don't have the full history, of course, of every pandemic in history. But it's really interesting to see the focus going from people on this vaccine and herd immunity, because I don't think we've done that in every pandemic.
Well, the difference between an epidemic and a pandemic is significant. An epidemic is a rapid spread of an infectious organism throughout a population. Now, I mean, that population could be the entire Northeast United States or the Southeast United States, whereas a pandemic really doesn't have a central region that it's affecting. It most often goes global. So when you think of a pandemic, the most common one is the Spanish flu. So when you go back into the early 1900s, we really did not understand epidemiology and how to prevent pandemics. People just knew that there was a serious influenza virus going around. And one of the most notorious examples of leadership gone stupid was the Thanksgiving Day parade in New York, where hundreds of thousands of people gathered for this parade, and they were all unprotected. So that became a hot spot and a major death center for the Spanish flu. Now, when we look at COVID sort of trickled its way through various populations. So while it originated in Wuhan, well, it came to the United States through a couple of ports in the Northwest, then a couple of ports in Europe, and a couple of ports in Australia. And it varied as to the time frame as to when a traveler carrying the virus went to some part of the world. So that's the difference between a pandemic and an epidemic. I mean, you could have an epidemic in the southern half of the state, but it's not a pandemic. Even if 40, 50, 60% of the population of that region were affected, it's still not a pandemic. It's still an epidemic. But once you have a pandemic, it really hits on a global scale with, it could be pockets of infection, or it could be just a broad population-wide infection.
I think that's a really important distinction for people to understand, because when I work with epidemiology students, a lot of times they have trouble with, epidemic, pandemic, and endemic. And of course, we talk about some things being endemic, meaning they're kind of ever present.
Right.
And I think it's really important for people to understand what these terms are as they're looking at things. Like, so you were talking about this Thanksgiving Day parade. What's really interesting is somebody did ask me, are masks effective at slowing the spread? And if so, how effective are they? And it's sort of interesting because it came into in my email box today, right next to the person asking if it's sexually transmitted, which reminded me of the time that Fauci was talking about, right? If you're going to go hook up, wear a mask. And it just cracked me up, the juxtaposition of the two questions.
Well, and it's a legitimate question. So, are masks effective? Certain masks are effective. So you don't have to have an N95 mask. I mean, that is overkill. Just a high quality disposable face mask is adequate to reduce your risk of infection and to reduce the risk to others of you spreading the virus. Now, there are these masks that you will see many people in a gym wearing that are sort of a cone type mask, and they sound like Darth Vader when they're breathing. So the mask itself doesn't have a filter, an air filter. It has a vinyl or live rubber flap. So it provides resistance when you're breathing. So it's a training mask. It's not a disease prevention mask. So are masks effective? Yes, they reduce the spread and the infection if you're wearing a mask from someone from the outside. So it lowers the risk of infection. Now, does it mean that the mask is going to completely, prevent infection? No. These little things at the end of your hand right here, they touch everything. And if you don't wash them and sanitize them, the first time you take your glasses up and wipe your eye like this, well, you just put yourself at risk for infection. So therefore, the mask didn't do you any good. You also have to take care of the rest of you that touches objects. Now, when it comes to sexual transmission, as far as I know, the virus is not sexually transmitted. And Fauci was comically correct. If you're going to hook up with a stranger, wear a mask. I personally would say wear a mask and something else, but it's just personal preference, I guess.
I just thought the whole thing was very funny. And I always, tell people, and of course I don't do patient care like you do, but when people ask me, I always tell them it's a trifecta, right? It's the social distancing, the hand washing, and the mask. And you have to wear the mask correctly, because I've also noticed a lot of people will wear it. I don't know if I have a mask here in my drawer. Sometimes I do.
Under their nose.
Oh, I do have one here. So I see them wearing it like this.
Yes.
Or like this.
Yeah.
Or like this.
My favorite is where it's covering the mouth but not their nose. And I see that at the gym all the time. Now, mind you, my gym took some pretty strict measures. They even put up plastic barriers between the aerobic equipment and then still separated each piece that was usable by two pieces that were blocked off and not usable. So they did a great job in reducing the risk in terms of sort of the distancing part of it. But they allowed people to perform their aerobic exercise without a mask. So they're still in the gym on a treadmill, running, breathing hard, spitting all over the place, and not wearing a mask. So it really wasn't that effective. And the other thing is cleaning your machines before you get on a machine and when you get off a machine. Be courteous. You know, it's like housekeeping. Hopefully, you don't have someone else clean up after you in the kitchen. But apparently, a lot of the people in my gym don't know how to use a paper towel and sanitizer still.
Yeah, I've seen that a lot. In fact, when I see pictures of people at the gym, I often think giant petri dish because
Yeah.
I used to go to a gym and I saw that a lot. I've started taking Brazilian Jiu-Jitsu since we've started doing the show. And we train in a small group. There's 4 of us, and it's very physical. So I don't wear a mask when I go there, and nobody else does. But it's a small group, and nobody is positive. And of course, if we tested positive, we would tell each other, and it's a very small percentage of people when you talk about 4 people regularly. Um, So with that discussion about gyms, which is great actually, because I have another episode that I'm going to be talking about that. Um, what about this whole thing about COVID altering your DNA and your structure? I've heard this about both the vaccine and the virus. Like you're going to turn into something else after you've had this illness. What about this mythology?
Okay, so any vaccine used in the world today is made out of a viral fragment of some kind. So the viral fragment does not have the capability to affect your DNA. What it will do is work with your cells to activate those sensor cells, whether it's a macrophage, the big cells that eat up a bacteria whole, or trigger the immune response, with your B cells and all of that, to create the antibodies. So it doesn't create a new genome for the person who received the vaccine. It simply triggers your immune response, which has a genetic component, most definitely, but it does not change your genetic structure. I mean, heaven forbid, we would be creating the zombie apocalypse if that were the case. But at this point, no, our vaccines, despite the fact that they were issued on an emergency order, are not affecting our DNA. Now, there is something to be aware of with a vaccine, and I mentioned this the last time I was on your show, is that not so much the vaccine, but the COVID infection is having some odd side effects when it comes to the autoimmune responses, the inflammatory response, the clotting factor response. We are now finding actual genomic markers in specific patients that will indicate if you're prone to develop blood clots with COVID infection. Now, the COVID vaccine, however, only because it's mRNA in a partial sequence of the virus, is that going to be sufficient to trigger one of these major total body responses? Well, so far, only people that have been allergic to the preservatives or had an unusual side effect with the first batch of, well, in the Johnson and Johnson case, there was a problem with the production. There were initial problems with the Pfizer and the Moderna vaccines during the first issue of them. There are always refinements made in these vaccines based on your immune response. And yeah, some people did develop some clotting problems and respiratory issues with the very first batch. I'm not seeing that now as we go down this road to, a more complete immunity like herd immunity.
And I saw also that we have a couple one second generation and probably a third generation vaccine coming down the pike for the fall. So we are learning from our collective experience. One of the questions that I get asked a lot is about the data related to this pandemic, and specifically about death data and also vaccine data. But what do you think? Do you think that the data being produced, is accurate data? Because based on what I see, I think it's as accurate as we can make it.
Well, data, it's just like junk in, junk out. The data that you input into your statistical analysis needs to be accurate. Unfortunately, I am seeing a lot of inaccurate reporting. And even in this area of Massachusetts, Western Mass, there are holes in the data. So therefore, are we having really precise figures and outcomes of our analyses? Not really. We are in the ballpark. And I think at this point, with COVID being such a new virus and it's a pandemic, we are going to have many loopholes in our data collection and analysis systems. So, yeah, I mean, we have basic numbers to work with. Are they accurate? They're strong indicators. Maybe someone will go through all of the data 2 or 3 years from now as we're working on our third generation of vaccines, and they'll go, oh, gee, we didn't realize that such and such state had a pocket that, oh, this data was really off. So yeah, we're still getting general information, which at this point in the game might be the best we can work with and hope for.
Yes, and that's the conversation that I have a lot with people, because I work with COVID reporting right now and data analysis and all of that are around those issues. And a lot of times what happens is we call them like data junkies or armchair data scientists. They get together and they decide to calculate, for example, a case fatality rate, but we don't have all the information. Like if somebody goes to the hospital today and they don't die, right, then your case fatality rate looks like it's 0 for today, but that doesn't necessarily mean that your case fatality rate is 0 ever. So, this is one of the things that we probably won't really know until a few years down the line when somebody does go through it. And this is probably true. I don't know what kind of data they kept for the Spanish flu pandemic, but the same thing probably happens with the Spanish flu pandemic. Maybe not right now because it's so far back, but I think the more we study these things, the more we get new things out of the data.
I think you're right on the money with the fact that this information is being collected live. I mean, this is not something that, it's after an event happened, we're taking data that we know is solid. This is being collected on the fly, and people make the biggest stupid mistakes imaginable, and we all do that. So it's no one's fault, but there's also something to be said for educating reporters. Now, people in clinics, hospitals, community health centers, the county health nurse, everyone needs to be educated on how to correctly report data. So I think a good example is if they're looking at fatalities from COVID. So you could have been admitted with COVID pneumonia, spent 3 days on the med-surg floor and treated and was feeling better. Then all of a sudden you developed a pulmonary embolus, a clot in your lungs. Well, then you get shipped to the ICU and you're intubated. While you're in the ICU, you develop a clot in your leg and then you die. So when you're admitted to the ICU, you're not admitted as a COVID patient. you are admitted as a pulmonary embolus patient or a DVT patient. So your diagnosis has now changed. Well, someone needs to go through the medical record and correct the diagnosis as pulmonary embolus secondary to COVID infection. And that way you can have an accurate data point to report. But that's not happening. Some people are discharged while they're really not ready to be discharged, but insurance won't let you have more than 3 days hospital admission. So I think at this point, chart reviews by hospitals and clinics will clean up some of this information, and it can be put into the data bank and corrected. I mean, we're always correcting data in research anyway. So this is essentially a type of research, and that's what we'll have to do is, we get a spell check and that's really about it.
I feel like that's what I do all the time in my data quality role. I feel like that's what I do, spell check the data. So that's very funny. And that is a whole nother topic for a show, but I like where you're going on that. I think that that's all very true. That's my experience. I spend a lot of my time educating people, mostly in nursing homes, but how to report data, why I want it this way, why I want it in this time frame. And I don't know, I think I spend half my day educating people on how to do things. So Larry, thanks for coming to talk about pandemics and myth busting.
Thank you again.
We'll talk about vaccines and men's health coming up, and I'm really excited. Thank you so much.
You're quite welcome. Looking forward to another visit.